Today, we're breaking down the $26 million available in new funding for behavioral health in New Mexico. If you work in behavioral health in New Mexico, you know how hard it is to keep up with the demand. You see the stories up close, people waiting weeks for a detox bed or simply can't get the care they need. The New Mexico Healthcare Authority just released a new program to change that. It's $26 million in early access money designed to get into your community right now. And in this video, I'm going to break it all down for you. We will cover the 4 critical areas that this money funds, who is eligible to apply, and the exact deadline that you need to know. And we know that when you're writing a grant proposal, getting a quote for a mobile unit can be a big item. And to solve that, our team is ready to help you with getting accurate pricing so you can write it into your grant. So what is this new program? It's called the Early Access Regional Plans Funding. It was created by the New Mexico Healthcare Authority and is part of the state's larger Behavioral Health Reform and Investment Act. Instead of making communities wait for long-term plans that have yet to be finalized, this program is designed to get money out the door fast. And the total amount available is $26 million. The state is divided into 13 behavioral health regions, and each region can apply up to $2 million to address its most critical needs. This money is flexible. It can be used for program startup costs, hiring and training staff, infrastructure, and even outfitting mobile units. The funding is targeting what the HCA call the 4 most critical access shortages. Your proposal grant must address one or more of these 4 critical areas. The first critical area is prenatal and perinatal substance use disorder treatment. This is one of the toughest challenges in healthcare. Expectant mothers who want help with substance use disorders are often afraid of judgment, or they live too far away from a treatment center to get the care they need. This funding can be used to build family-centered residential programs or substance use disorder treatment services. The state specifically mentions using mobile counseling units to reach rural areas or tribal communities so that mothers don't have to travel for care. The second most critical area is the crisis continuum of care. When someone is in a mental health crisis, every minute counts. In many parts of New Mexico, a long drive to an emergency room is the only option. And first responders are often police or EMTs who are generally not equipped to treat a behavioral health crisis. This funding is meant to create better and faster responses. It can be used to build crisis triage centers, certified behavioral health community clinics, or mobile crisis teams that meet people where they are. Instead of an ER visit, a trained counselor can de-escalate the situation and connect the individual to ongoing care. The third critical shortage is medicated assisted treatment, or MAT, for justice-involved individuals. For anyone leaving jail or prison, getting access to addictions treatment medication is the most critical piece between relapse and recovery. But so many people lose access to their care when they're released. This funding can be used to expand MAT programs within jails or prisons to treat these individuals. It can also be used to hire peer recovery specialists and purchase mobile MAT units. It allows someone to have treatment while they're incarcerated and then follow them with Medicaid-assisted treatment afterwards. The fourth and final area is the residential treatment continuum of care. This part of the funding is meant to answer the question, what happens next? Too many people finish rehab and find that they have nowhere to go. This funding can be used to fix that gap by creating or expanding recovery housing, transitional housing, or accredited residential treatment centers. It's about building a stable environment so that recovery can last. So how do you actually get this funding? The eligible applicants are the 13 behavioral health regions. Each region must name a accountable entity to lead the grant. This could be a local government, a tribe, a pueblo, or another public agency. That accountable entity can then work with service provider organizations to deliver the service. If you're a tribal community, a nonprofit, or a community healthcare organization, you should be reaching out to your local entity within that region so you can be part of the grant. Applications are due December 19th, 2025. This is an extremely tight deadline. Awards will be announced in late January of 2026, and the funding starts in February of 2026 and must be used by June 30th of 2027. This timeline means that you must act fast. So to wrap it all up, New Mexico has $26 million available for behavioral health services. The funding is focused on 4 critical areas: residential treatment, crisis care, MAT for justice-involved individuals, and prenatal SUD treatment. Transportation is one of the biggest barriers to care in New Mexico. This funding can be used to purchase or outfit a mobile unit that will solve that problem. We know that getting a quote for your grant application is a critical piece. Our team specializes in this, and we can get you a quote that you can include in your proposal. Click the link in the description to talk to an expert today. If you have any questions, drop them in the comments below. We're always here to help.